Hello, welcome to the fiscal year 2024 Runaway and Homeless Youth Maternity Group Home Program pre-application webinar. My name is Tim Joyce. I'm the MGH coordinator for the Division of Runaway and Homeless Youth. We can go to the next slide. Okay, we have four primary goals for this webinar. One, to orient potential applicants to the fiscal year 24 Notice of Funding Opportunity announcement. Two, provide an overview of the Runaway and Homeless Youth Maternity Group Home Program, or MGH. Three, address eligibility requirements, application processes, and timelines. And four, respond to the questions that were submitted in advance of this webinar. Next slide, please. Okay, here's a list of the types of organizations which are eligible to apply for MGH grants. These are primarily nonprofits and public organizations, including tribal, local, or state government entities, and it may include school systems. We can go to the next slide. And these are the types of agencies which are not eligible to apply. If your organization is a for-profit entity, you're not eligible. Universities and colleges may apply as long as they're not for profit. An individual person or a foreign organization cannot apply for funds. And if you are a local or state government agency that is part of a juvenile justice system, your organization is not eligible to apply. Next slide, please. Here's the application and review process for MGH. Applications are due on June 7th before midnight. If you experience issues with grants.gov, the Ask Grant Help chat function will provide more efficient support than reaching out to our program office. Next slide, please. Okay, and this is how MGH applications will be reviewed. You'll receive a notice of being awarded or not awarded in September of this year. And please be advised that there is no appeals process for the grant for any grant applications which are not funded. We can go to the next slide. Okay, the MGH notification of funding opportunity, or the NOFO, is comprised generally of the sections on your screen here. We'll walk through these components today. Be sure your application addresses all aspects of the NOFO. Information about reporting, national program and administrative requirements, and other key definitions can be found on the Family and Youth Services Bureau website under the Application Resources tab. Next slide. The goal of the MGH program is to help pregnant and parenting youth and young adults who have run away or experienced homelessness establish self-supportive, sustainable living and well-being for themselves and their young families. Next slide. Okay, MGH projects must provide both shelter and supportive services for pregnant and parenting youth and young adults, ages 16 to under 22, and their children. Youth who are currently in dependent custody of a child welfare or juvenile justice agency are not eligible for MGH. Please note that for the purposes of this presentation and the NOFO, we use the term youth to describe youth and young adults ages 16 to under 22 of any gender, sexual identity, ethnicity, and marital status who are experiencing homelessness, have run away, or are at risk of becoming homeless or running away. Next slide, please. Next slide. Okay, I'll walk through the project requirements, starting with safe, stable, and appropriate shelter. This includes community-based, adult-supervised, safe, and stable housing through a continuous period not to exceed 540 days, or in exceptional circumstances, 635 days. Direct on-site supervision with a ratio of staff to youth that is sufficient to ensure all youth and their dependent children receive adequate supervision and services at each shelter facility that is not a family host home. Individual facilities must have the capacity to accommodate a minimum of 4 and a maximum of 20 20 individuals, excluding staff, except in certain cases such as apartment buildings with multiple floors, scattered site programs, and municipalities with conflicting licensure requirements. MGH staff must be trained to interact with youth victims of trafficking or other similar traumatic experiences, and there must be separate beds for youth and infants and/or children. Next slide, please. Okay. Safe, stable, and appropriate shelter also includes agreements or linkages with an age-appropriate emergency shelter for circumstances when there are no current MGH openings. Services for all pregnant and parenting youth and their children, keeping in mind that MGH is not just a program for young women. Ensuring all staff are appropriately trained to interact with youth who may be at high risk for trafficking and sexual exploitation and may have experienced a great deal of trauma, and supports for youth to exit MGH to safe and appropriate settings. Next slide, please. All RHY grant programs require awardees to execute a comprehensive youth-centered services model, which incorporates two frameworks: trauma-informed care and positive youth development, or PYD. Trauma-informed approaches understand and respond to the symptoms of chronic interpersonal trauma and traumatic stress, as well as the behavioral and mental health consequences of trauma and prevention of re-traumatization. PYD program designs recognize young people's strengths and promote positive outcomes by providing opportunities, fostering positive relationships, and furnishing the support needed to build on their leadership skills. Your program must include a plan to provide a safe, inclusive, and culturally responsive space and services for all youth, including youth facing disabilities, youth of color, youth who identify as LGBTQIA2S+, and youth from other underserved populations. You must also be inclusive of the language access needs of youth and their families. Next slide, please. You must develop and describe a plan to conduct direct outreach to youth who have run away, are experiencing homelessness, or are at risk of becoming homeless or running away. You must also inform your community about and encourage the use of MGH services and ensure the RHY National Communication System is updated with accurate information about your project. Development of your outreach implementation strategy must engage youth with lived experience to ensure the outreach, education, and awareness work is grounded in youth voice. Next slide, please. When necessary, MGH outreach includes providing gateway services, which means emergency items such as food, water, clothing, hygiene items, transportation, personal safety information and resource guides, referrals, and other items suitable for homeless youth and infants, toddlers, and children. Next slide, please. Okay, you must have a standard method to determine youth eligibility for MGH services, and if the youth's participation in an MGH would pose any risks to the safety of other youth in the program. Assessment should prioritize reunifying youth with a positive adult connection who can provide stability and has the youth's best interests in mind. Screening tools should include, should at a minimum assess the following factors: sexual and human trafficking, need for substance abuse and mental health services, underserved populations such as tribal youth, youth with disabilities, and youth who identify as LGBTQIA2S+. Next slide, please. After assessing the needs of the youth and family, you must coordinate, monitor, evaluate, and advocate for services to their specific needs. This case management includes an individualized service plan based on the youth's goals, services and record keeping for the infant, toddler, or child of the youth, including well care visits and sensory and developmental screenings, a service coordination plan with an appropriate referral strategy based on the screening and assessment must be completed at program entry. Referral services should include, but are not limited to, vocational and employment services, public benefits, legal services, mental and behavioral health, medical care, health insurance, and affordable child care. Also, you must support youth to be engaged in educational advancement, vocational training, or to be actively employed while in the program. Next slide, please. Your MGH program must provide youth with life skills training and referrals to promote their long-term economic independence and to support the well-being of their children. At a minimum, training and referrals in the following areas must be provided. Child screening and assessment tools. The developmental screening for each infant, toddler, and child must be completed within 45 days of entering an MGH. Child care and/or Head Start. Parenting skills which promote positive parent interactions. An evidence-based parenting curriculum to support positive child outcomes. Child development, which must also be documented in the child's file. Job attainment and educational advancement, including coordination, when appropriate, with your local McKinney-Vento liaisons. Financial literacy and budgeting, including credit counseling, consumer education and budgeting. And health and nutrition, including early and consistent pre- and postnatal care, understanding healthy relationships, managing stress, and healthy meal planning. Next slide, please. Okay, transition planning and aftercare. MGHs work with each youth to develop a transition plan to ensure safe and stable living after leaving the MGH. You must provide aftercare services for a minimum of 3 months after the young family exits the residential portion of the program. Aftercare services involve meeting with the youth in a method that works best for them. Aftercare planning should include an agreed upon strategy for meeting, communicating, and documenting services, access to all critical documents for the youth and their children, referrals to appropriate services, and a strategy to ensure the youth have received these services, ensuring the youth and children have appropriate medical coverage, supporting youth to remain connected with school, vocational training, or employment, and proactive and reactive strategies to encourage retention in employment, housing, childcare, and medical care. Next slide, please. Okay, the project narrative, more or less, these are directions for you to explain how your project will meet the purpose of this NOFO as we just described it. We can go to the next slide, please. Okay, your application should include these 3 elements: a table of contents at the beginning, a brief project summary, and the project narrative, which we're going to walk through now. And this is where you address all your proposed activities. It is a critical section of your application, which we evaluate and rank using the merit review criteria, which we'll also walk through. We are particularly interested in project narratives that convey strategies for achieving intended performance. It is very unlikely that this can be done merely through the submission of a short description of your organization's goals and capability or through a short business plan. Next slide, please. Okay, and the project narrative is comprised of these 11 sections on your screen here, and we'll start. You can go to the next slide. Okay, geographic location. Include the precise physical location of your project and the boundaries of the area you will serve. If you have any subrecipients in your project, include their locations as well. Next slide, please. The need for assistance. Identify the problems you plan to solve. These problems could be physical, economic, social, financial, institutional, etc. To do so, demonstrate the need, including the nature and scope of the problem. You may provide supporting documentation such as letters of support and testimonials, and you can include those in your application's appendix. Include any relevant data based on planning studies or needs assessments. You may refer to them in endnotes or footnotes. And use demographic data and participant or beneficiary information where you can. Next slide. Okay, the approach section. And when you're developing your proposal, you should outline a plan of action of how the project will be accomplished, including a detailed plan and approach to addressing all aspects of the NOFO's program description. For the housing model and structure, Include a description of the physical structure to be used. For example, single structure, multi-story, scattered site, tiny homes, etc. Include a description of the practices, procedures, and client safety, including how your staff to client ratio is adequate and ensures safety. Include how you will use trauma-informed and PYD approaches. And for ensuring equity, include a description of staffing practices which ensure diversity of staff and organizational leadership that reflects the backgrounds and experiences of the youth in the MGH. Next slide, please. For the approach, your application should also include how your MGH will implement an outreach strategy to engage youth and the community to provide education about MGH services, how your project will meet youth's basic needs, a description of how your MGH will determine youth's eligibility and other risks and protective factors that impact well-being and potential for sustainable living, how your program will provide case management services to the youth, infants, toddlers, and children, life skills training, childcare, and referrals, including explanations of how your MGH will support youth in maintaining or advancing their schooling or training, what life skills and parenting curricula will be utilized, how you will assess and document the development of the young children in the program, your procedures for linking young families with childcare or Head Start, and any obstacles you foresee for accessing safe and affordable childcare. How your MGH will support youth in transition planning and aftercare, including ensuring that they remain linked to your program for a minimum of 3 months, as well as linked to services, housing, education, benefits, and permanent connections. And finally, partnerships and service coordination. Tell us about how you coordinate with your partners in government, schools, COCs, and other youth serving providers. You should cite potential obstacles to accomplishing project goals and explain strategies that will be used to address these challenges. Next slide. Okay, organizational capacity. In describing your organizational capacity to manage the project, you should provide evidence that your team has the relevant experience and expertise needed to carry out your project, including working collaboratively with youth for your program design, implementation, and improvement. Describe your team's experience with administering, developing, implementing, managing, and evaluating similar projects. Provide experience that your team has the organizational capacity to fulfill their roles and functions effectively. And explain which continuum of care you'll partner with for RHY HIMSS data collection. If you are not a member of the COC, or if your project spans across multiple COCs, you must explain your plan to contact and work with a COC HIMSS lead for data collection or reporting. Next slide, please. Your narrative must also describe how you'll ensure proper oversight of your award. This should include a description of the governance, policies, and procedures and systems you will use for record keeping and financial management, a description of the procedures to identify and mitigate risks and issues. These might include audit findings, continuous performance assessments, findings, and monitoring, and key staff who will be responsible for maintaining oversight of program activities, staff, and any partners or subrecipients. Next slide, please. In describing your project performance evaluation plan, you should explain how you will monitor ongoing activities and the progress towards the project's goals and objectives, the inputs, key activities, and expected outcomes of the funded activities. Inputs might include your collaborative partners, key staff, budget, service processes, or other resources. How you will measure the inputs, activities, and outcomes, how you will use the resulting information to inform improvement of funded activities, any processes that support the overall data quality, the organizational systems and processes that will track performance outcomes, and how your organization will collect and manage data in a way that allows for accurate and timely reporting of performance outcomes. Next slide. Okay, your narrative must also include a logic model. which is a diagram that presents how inputs drive activities to produce outputs, outcomes, and the ultimate goals of the proposed project. It should explain the links among project elements and target the identified objectives and goals of the project. The description of your logic model must also include details about the program's inputs, such as additional resources, organizational profile, collaborative partners, key staff, or budget, target population, such as individuals to be served or identified needs, activities, mechanisms, and processes, such as evidence-based strategies, best practices, approach, key intervention and evaluation components, and continuous quality improvement efforts. Outputs, which include the immediate and direct results of program activities. Outcomes, which include the expected short and long-term results that you expect the project to achieve. These are typically described as changes in people or systems. Project goals, such as overarching objectives and reasons for proposing the project. And you must describe how the proposed activities, inputs, and outputs will link to outcomes associated with youth achieving performance improvement. Next slide, please. Okay, the project sustainability plan. Your applications must propose a plan for project sustainability for when after the period of federal funding ends. MGHs are expected to sustain key elements of their grant projects, such as strategies or services and interventions, which have been effective in improving practices and outcomes. Describe the approach to project sustainability that will be most effective and feasible, including a description of key individuals and organizations whose support will be required. You should address the types of alternative support that will be required to maintain the program. If the project involves key project partners, you must describe how their cooperation and collaboration will be maintained after the end of federal funding. Next slide, please. Okay, describe how you will collect and safeguard personally identifiable information and other information that is considered sensitive. Make sure your approach is consistent with the applicable federal, state, local, and tribal laws regarding privacy and obligations of confidentiality. Provide the methods and systems you will use to ensure that you properly handle confidential and sensitive information, including any subrecipients and contractors, and provide a plan for the disposition of such information at the end of the period of performance. Next slide. Okay, the line item budget and budget narrative. When you're developing your budget, consider if the costs are necessary, reasonable, allocable, and consistent with your project's purpose and activities. Consider how you calculate your costs in ways that are clear and repeatable, and consider how funds are restricted. You must also include the cost for sending at least one person to attend the annual in-person RHY National Grantee Training, in-person regional trainings, and up to 2 collaboration events, as well as the estimated cost for obtaining necessary equipment and training for HIMIS. If you already have this equipment, you must note this in your application. Next slide. Okay, the merit review. This is for the merit review process. Third-party reviewers will review and score your application based on how thoroughly you answer the questions in the evaluation criteria and sub-criteria. These subsections correspond to the required components of your application as described in the program description and project narrative. It is critical that you address each criteria and sub-criteria. We can go to the next slide. Okay, so we'll start with need for assistance. Explain in your application why assistance is needed. In other words, demonstrate the need. What's the extent of youth homelessness in your community and what resources are already in place to address it? Also tell us who will be the recipient of the services. Give us demographic data and participant or beneficiary information where you can. Next slide, please. Okay, approach is a big section, so we're going to go through a bunch of slides for approach. First off, we're going to consider the extent to which you have developed a comprehensive program approach that clearly describes your proposed housing model describes your plans for ensuring safety for all participants in the program, and describes your comprehensive youth-centered services model. Next slide. We'll consider the extent to which you have developed a comprehensive program approach that clearly details your strategy for outreach, education and awareness, and provision of basic needs, and describes how youth with homelessness expertise are engaged in the outreach implementation. Next slide. Additionally, under the approach, we will evaluate your application on how well you explained your program's youth screening and assessment process, and whether you include a sufficient description of the screening tools you'll use and how these will inform service delivery. Next slide. Under approach, we will also evaluate your application on how well you explained how case management will be conducted and what your strategy for delivering life skills training, childcare, and referrals will be. Next slide. Finally, under the approach section, we will evaluate your application on how well you explained your plans for transition planning and providing aftercare services for youth when they exit the program, how well you explained your program, how your program will use various methods to support youth and young families in improving social and emotional well-being and permanent connections, and what your proposed referral processes are to ensure external agencies provide support to your youth. Next slide, please. In reviewing your capability to ensure equity, we'll be looking for how you promote equity for youth and young adults from underserved groups as detailed in the program requirements and project narrative. Next slide. In reviewing the performance evaluation plan, we will consider the extent to which you effectively provide an effective approach for evaluating progress, what you will do to improve it, and what challenges you will face. We will also evaluate your proposal to operationalize the plans and activities as detailed in your proposed logic model. Next slide. In reviewing your organizational capacity, we will consider the extent to which you effectively provide evidence of experience and expertise in operating runaway and homeless youth projects designed to prevent and end youth homelessness, and detail your plan to ensure your client data is uploaded to RHY HIMSS accurately and on time. Next slide, please. For third-party agreements, detail the scope of work to be performed through third-party working relationships with subrecipients, subcontractors, or any other cooperating entities. Next slide, please. In reviewing the budget and budget justification, we will consider the extent to which you thoroughly provided a clear line item budget and budget narrative for the federal amount and non-federal share in your application. We'll evaluate whether your budget clearly explains why the funds are necessary and confirm you included the cost of sending a staff person to attend the required training and meetings. We will also evaluate how much you propose it will cost your organization to run the project, what other funding in addition to the award funds will be required, what the source of those funds is, and how you've described what oversight of the award funds and activities will be. Next slide, please. Finally, the sustainability plan. We want to know how you will sustain your project, to include how you'll look for secure, diverse funding, retain staff, and continue supporting the program. Next slide, please. Okay, other important items. Next slide. Okay, while you're not required to address them in your application, should you receive an MGH award, you will be required to comply with specific reporting and administrative and national policy requirements. You should carefully review the key definitions related to this NOFO available on the FISB website. A link is provided at the bottom of page 54 of NOFO. Please be sure your organization is able to comply with these requirements. Failure to meet these requirements can result in the termination of your grant. Next slide, please. Reporting. If you are awarded an MGH grant, you will have to submit financial and performance reports. All MGHs collect and report specific data via the Runaway and Homeless Youth Homeless Management Information System, RHY-HIMIS, and via the PPR, Performance Progress Report. To learn more about reporting, see the reporting section on the ACF website. Next slide, please. RHY's final rule established program performance standards across the BCP, TLP, SOP, and MGH grant programs. We can go to the next slide. If awarded, you will be responsible for consistently enhancing short and long-term outcomes for youth. Youth and MGH programs must see improvements in these four core outcome areas. Indicators of improvements include, but are not limited to, 1, social and emotional well-being. Connect pregnant and parenting youth to a system of trauma-informed care providers to promote positive and healthy messages for them and their children, and assist youth with improving physical and mental health, safety, and wellness for themselves and their young families. 2, permanent connections. Youth must experience positive ongoing attachments to families, communities, schools, and other social networks. 3, education or employment. Your youth must be connected to schools, including post-secondary education or vocational training programs, and demonstrate improvement in interviewing skills, job attainment skills, and employment. And 4, safe and stable housing. Pregnant and parenting youth and their young families must transition to safe and stable housing that appropriately matches their level of need after leaving an MGH. Next slide, please. Okay, we received a handful of questions in advance of this webinar, and we're going to answer those now. So we can go to the next slide. Okay, this question asks about how there are a number of documents required in the organizational capacity attachments. They ask, since these documents are long, we will not be attaching them, but describing them. What will the reviewers be looking for? I can't include everything, and I want to make sure to touch on the salient points for this application, but I'm not clear on the intent of the personnel policies particularly. Do you want proof that we have them, or that we have specific policies? The answer is we recommend including a summary or table of these items. Next slide, please. Question 2, can an organization submit separate proposals for the transitional living program and the maternity group home program? Can an organization receive a grant from each program to serve different youth? If you attended the TLP webinar this afternoon, there's a spoiler because they addressed this already. But if you weren't there, the answer is yes. You may submit multiple applications to include separate applications for MGH and TLP. Your application should describe the specific populations of young people you propose to serve. Next slide. Question 3, the NOFO states that your program must be prepared to serve pregnant and parenting youth of all ages from 16 through 21. Is it acceptable for an agency to serve minor youth in a different program instead of through the MGH project? We use a scattered site approach for transitional living and feel the needs of younger youth are better served through other agency programs that we offer. Answer. An applicant can propose serving a specific population. However, you must include a mechanism to refer other youth who are not part of your target service population to services that are comparable to MGH. Next slide, please. Number 4. If I currently have a licensed group home entity and the site is licensed, does it require me to get a child care license as well? Facility licensing varies from place to place, so it's difficult for us to be very helpful with these questions. But what we will say is that licensing must be appropriate to the population of individuals receiving services and is subject to state or local law or regulations. And we just want to make sure that you're able to demonstrate proof of licensure. Next slide, please. Okay, question 5. Page 10 of the NOFO states, quote, if your MGH project serves adult homeless populations over the age of 22, You must have policies and practices to separate MGH youth from the older adult population, end quote. However, the target population is listed as 16 through 21. Should the sentence above be revised to state, quote, over the age of 21? Otherwise, it sounds as if those ages 22 are within the age range or in a gray zone. Our answer is, youth who enter the MGH at 21 are eligible to receive services for 540 days and up to 635 days in exceptional circumstances. MGH youth should not receive shelter and services in the same program as older adults. So if your program serves individuals outside of the MGH age range, those folks should not be housed in with MGH clients. Next slide, please. Number 6, on page 10 of the NOFO, or rather, page 10 of the NOFO states, quote, MGH projects must have an agreement with an age-appropriate emergency shelter that can accommodate pregnant or parenting youth and their dependent children in circumstances when there are no current MGH openings, end quote. There are currently no shelters in our service area that are licensed to serve unaccompanied minor parents and their dependent children. We are legally obligated to contact the State Department of Child Protective Services to address the shelter needs of these youth. Does this meet the requirement as stated in the NOFO? And yes, we understand that an age-appropriate shelter, especially for young families of minor age in particular, may not be accessible in a lot of communities, but we do want to ensure that your project has a process in place to support these individuals. So our answer is in your application, you must explain the process you will follow for referring youth for other services if you are not able to provide them shelter and services through the MGH. Next slide, please. Okay, question 7. Page 10 of the NOFO states, quote, per regulations at 45 CFR section 1351.18 part C, the facilities of your MGH project must have a minimum residential capacity of 4 and a maximum residential capacity of 20 individuals in a single structure, end quote. And page 9 states, quote, safe and stable shelter is defined as a community-based, adult-supervised transitional living arrangement for youth and, if applicable, their children. This includes group homes, host homes, and scattered supervised apartments, end quote. If we operate our MGH as a scattered site apartment model, does this mean that we could house one household in an apartment at a complex with no other MGH households, as long as the apartment complex had capacity to serve at least 4, but not more than 20 individuals in alignment with this requirement? And survey says, next slide. Answer, your program must have the capacity to provide shelter and services to a minimum of 4 youth and specific to MGH, not more than 20 individuals in a single structure. The maximum of 20 individuals only applies to apartment buildings if they are on the same floor of the building. 20 individuals is equal to a combination of youth and their dependent children. The minimum and maximum capabilities related to a single structure do not apply to a supervised scattered apartments model. Okay, next slide, please. Question 8, page 10 of the NOFO states, quote, your program must be prepared and able to serve pregnant and parenting youth of all ages from 16 through 21 and of all genders, end quote. Because our MGH operates in an apartment-based setting, participants must be legally able to sign a lease. Under our state law, that means that if participants are under age 18, they must be legally emancipated or in a household with a partner age 18 or older. Do these legal parameters governing the age range we can serve adequately address this requirement stated in NOFO? Similarly to question 3, MGH funds are to support all eligible youth between 16 and under 22. If your project will not be targeting this entire age range, you must still have protocols in place to ensure that if youth outside your age range are referred for or request services, you're still able to link them to appropriate services which are comparable to MGH. Next slide, please. Question 9. We have 5 youth and young adult crisis transitional housing units, along with a congregate housing transitional living unit funded through other sources across a 5-county region. We would like the opportunity to provide MGH services to pregnant and parenting youth who need assistance in each of those 5 counties versus having one centralized location that might not be conducive to all youth needing services. Can the MGH grant support this type of activity? Each of the units have a minimum of 4 beds, but they may not all be used by pregnant or parenting youth. Yes. Our answer is yes. Your program must have the capacity to provide shelter and services to a minimum of 4 youth. Next slide. Okay, question 10. Page 6 of the NOFO states, quote, minimum award amount for the first budget period, award ceiling, $250,000. And for funding periods, it says 60-month period of performance with 5 12-month budget periods. Please confirm if an applicant applies for $250,000 in years 1 through 5, then their total award would then be $1,250,000. The answer is yes. The period of performance for MGH is up to 60 months, consisting of 5 12-month budget periods of not more than $250,000 per budget period. If an agency applies for and is awarded the maximum award across all 5 years, then yes, it would be $1.25 million. Next slide, please. Okay, this is the last question. Number 11, can an applicant provide an in-kind non-cash match from their own organization, not from a third party? Yes, cost sharing may be cash, in-kind, or a combination of both. All cost sharing contributions may come from the agency submitting the application and request for funding. The contributions must be clearly identified in the budget and budget justification. We can go to the next slide. Okay, I appreciate everyone's interest in the maternity group home program, and we look forward to reviewing your application. My name's Tim Joyce again, and my contact information is in the NOFO, so please feel free to reach out if you have any follow-up questions, and we'll guide you in the right direction. Thanks, everybody.